This is the Fix Your Sciatica podcast. In the never-ending quest of trying to manage pain, you get an opportunity to come across a lot of very cool and interesting tools. And recently, I came across a couple different articles about the use of possibly some hyperbaric oxygen therapy. And the thing is that being a physical therapist, I don't really know that much about it. I know that hyperbaric oxygen therapy is actually a really great tool for a lot of different medical conditions. But I was very intrigued when I came across these articles. And luckily, during that search, this company, the Inlight Way, and these the guests that we have today have a center that actually provides that and a bunch of other services. And they were very kind enough to actually share their knowledge and expertise on this cool, novel treatment that could be helpful. So today I have both Edna and Caitlin of the Inlight Way. Thank you for coming and taking the time to share your expertise with us.
Thank you for having us. It's great.
Yeah, I'm really excited because I am always interested in looking at different modalities that can be helpful. Also pretty natural. And then also a large part of it is things that are outside the scope of what I know. So I'm very, very excited to ask all these questions and learn and really just share some knowledge with the listeners so that they can take some action upon leaving an episode like this. So before we take a deep dive into hyperbaric oxygen therapy, tell us a little bit more about yourselves and what you do.
So I'm Edna and my business partner, Caitlin, and we have a 4,500 square foot healing center. We believe in combination therapy. And so we have a lot of different fun modalities that we use to help people to heal faster and just get long-term healing and reducing inflammation. But really our specialty is hyperbarics. And so we use it in conjunction with other things in our office. So I'm just going to run through them real quick just so you have an idea of the scope that we do. So we have infrared saunas, cold plunge. We have soft wave TRT, which is a shockwave therapy. It is great for pain. Hyperbaric oxygen. We do both hard shell and mild hyperbarics. So we have 6 hyperbaric chambers. We have 2 light beds and we have a lot of light devices. So we firmly believe in light therapy. And we also have vibration therapy and PEMF. Does that cover it, Caitlin?
Yeah, sounds about right.
Yeah. So we are in business because of our own healing journey. We started just doing light therapy 10 years ago and then brought in hyperbarics about a year later. And so we just have a lot of passion for what we do. We are not doctors, just a disclaimer, but we do have a medical doctor. And we just have a lot of passion for helping people to find natural ways to heal their body.
Beautiful. I mean, it's really great. I think that in the age of technology and these amazing medical advancements, we often overlook the power of some of these all-natural techniques and modalities and really tapping into what nature can provide for us. So I'm actually really glad that you have this. And I really appreciate you sharing that even though you're not physicians, you have a physician who's part of the team, which I think is very important because with natural remedies or natural modalities, oneoftentimes they're not regulated. And because they're not regulated or because you don't necessarily need to have a specific degree, anyone with enough money can buy these tools and say, hey, this is going to fix you. And that it ends up being one of the big challenges because of how easily accessible some of this stuff is that, you're getting it, but is it going to be the right modality for you? Do you really need this? Is this going to help? These are a lot of the questions that get brought up. And it's one of the reasons why I have a podcast like this, is to be able to break down a couple of the myths, but also help people understand the use cases for that. So let's talk about hyperbaric oxygen therapy specifically, because I mean, oxygen, it's the air we breathe. We need oxygen to function, right? We breathe in oxygen, we breathe out carbon dioxide. Can you tell us a little bit more about what is hyperbaric oxygen therapy?
So hyperbaric oxygen therapy is basically breathing oxygen, whether it's ambient air or extra oxygen, in a pressurized vessel at a higher atmosphere than what we live in. So we treat at varying altitudes. It's all underwater pressure. And the reason that you would want to do that, why would you want to breathe oxygen in a vessel that you're kind of locked into? It's going to dissolve the fluids or dissolve oxygen into the fluids of the body. So hyperbarics, if I had to say the one thing that it does the best at is inflammation. So it reduces inflammation. And how it does that is when we have inflammation, we get restriction in the blood vessels. And so oxygen doesn't get to all the tissue that it needs to, especially the tissue that's suffering. So there's a law that's called Henry's Law. And Henry's Law says when you put a gas under pressure, you can now dissolve it into the fluids. So once we put you under pressure, that oxygen is dissolving into the plasma and the cerebral fluids and lymphatic fluids. And now we're able to get oxygen to the tissue that's suffering and that's inflamed. And once it gets the oxygen it needs, then we can start reducing symptoms and reducing the inflammation. So hyperbarics is typically dosed in a series of treatments. And really, we want it's dosed in treatments as close together as possible, even preferably twice a day. So we believe that we should look at it like a supplement. It is a supplement of oxygen. So if you think about how you take, supplements every day, you take them every day. Sometimes you take them more than once a day to keep the levels of that supplement up in your system so that you can get the desired result, right? So hyperbarics is the same. Takes a little bit more time than just taking a pill, but that is how it's dosed. So we want to keep those levels of oxygen up in the tissue that's suffering. And that's how we can get pain relief and long-term healing.
This episode is brought to you by the Patient Advocate Program. Are you tired of not having support between your rehab sessions? Introducing the Patient Advocate Program, and we're focused on your recovery, and we're offering you 24/7 access to a doctorate of physical therapy. Stop waiting in line to be seen and stop spending hours doing long exercise programs. Imagine being able to get all of your care delivered straight to your phone. Best of all, it's affordable. We believe everyone deserves top-notch relief without breaking the bank. So why wait? Take control of your health today and visit ptpatientadvocate.com and book your free call with our experts. Amazing. I think number one, I really appreciate you saying that it's a supplement. It's something that aids in recovery. I think one of the challenges I come across when looking at various different modalities is that oftentimes they're going to say, you do this, all of your problems are going to be fixed. And as much as we would all like that to happen, a large part of the pain that we deal with, especially when it comes to something like sciatica pain, is often an accumulation of many different factors. And to overlook those other different factors would be actually providing a huge disservice to the person who actually needs recovery. And so thank you so much for saying that, and that it will aid in helping recover. And as you're describing hyperbaric oxygen, I was thinking, okay, well, we're adding, you're pretty much breathing a little bit more of like you're breathing in a pressurized environment. So yes, kind of like the exact opposite as, Marin County, I think I'm living at sea level. I think where you are up in Seattle, possibly at sea level. Hyperbaric, like the exact opposite of what hyperbaric oxygen would be like going up to the Colorado mountains and being up at altitude where the oxygen is very, very thin. Is that kind of like a good analogy?
Yes. And, a good analogy for people to like actually visualize what is happening inside of a hyperbaric chamber is the soda stream. So where you make carbonated water. So that's a perfect example of Henry's Law. We're putting a gas under pressure and we're making bubbles in the water. So that's really what's happening to your body when you're in a chamber.
Amazing. And in addition to that, I mean, you're ending up creating a much more concentrated, like people are breathing a much more concentrated amount of oxygen. And the way that oxygen, whether it be like oxygen, gases, minerals, whatever, it often passes through cell walls or cell membranes through the process of diffusion. And the simple law of diffusion is the fact that you go from like a high concentration to a low concentration. And so the way that I see it is that, especially when we're dealing with an inflamed tissue or an injured tissue, inflammation itself, that means that there's a lot of blood flow, a lot of irritation. That inflammation is there to actually try to heal the tissues. But if we have abnormal amounts of inflammation, it's a lot of energy and a lot of irritation, a lot of byproducts. And oftentimes it can kind of rob other tissues that need to heal of oxygen. So being able to provide this supplement to allow tissues to heal is a very, very cool thing. And so you said that in your facility, you have both a hard shell and I think you said a soft shell. So let's talk a little bit more about what the experience is like when it comes to going through hyperbaric. I've worked with a couple of patients who've gone through it, but they just said, no, it's just like you're sitting there and you're breathing. But I mean, that was their experience. So what is a typical experience? What can someone expect during a hyperbaric oxygen session?
So I'm going to separate them a little bit because they are really a different experience. The mild hyperbarics is more like it's like a fabric. And so it's a portable unit that has a zipper and it has windows in it so you can see out. The portable units typically go to 1.3 atmosphere, which is similar to 10 feet underwater pressure. And the experience that how I would explain the experience would be when you get in the chamber and you get zipped up and you start going under pressure, you're going to feel the pressure only really in your ears. So it's just like flying where you have to clear your ears. So like we give people gum so that they have extra saliva to be able to swallow and, do different things to clear their ears, do yawning, blow their nose. So once you get your ears cleared through the process, and the one thing I want to say about that is a lot of people think that if I have problems with my ears, I won't be able to get under pressure. We can take it very, very slow and still get somebody under pressure without any problems. So that's an important note, is that like when you're flying, if you have problems with your sinuses, you can't say, hey, slow down. So you may have problems clearing your ears. Whereas in the chamber, as long as we know you're having a problem clearing your ears, we just need to open a valve and release the air so that gives you more time to pressurize or to clear your ears. So once you get under pressure, the way that I explain it is it kind of feels like a gentle hug. So it's just the really gentle pressure against your body that I don't think you really you can really feel it. But once you've gone through a treatment or two and get relaxed in there, I think your body realizes or recognizes that it is something good for you. And it's like a little healing vessel. So very comfortable. It's got a mattress. Best thing to do when you're in there is take a nap. But you can read a book, you can listen to podcasts, music. So really just relaxing is a good thing. So inside of the hard shell, that's a steel chamber. And a lot of times people look at it and go, I'm not sure. That looks a little bit more intimidating. But it actually has a lot more room. So once you do get in there, and as long as you feel comfortable that that door is going to open for you in the end, you will be able to get out. It's a very comfortable experience. But it is a steel chamber. And so it feels a little bit more confining than a fabric. In the steel chambers, we can go to deeper pressures. So we typically stay at 2.0 and below. 2.0 is about 33 feet underwater pressure. And so depending on, what somebody's coming in for, what their prescription will say. And it does take a prescription. Our we do fill prescriptions. People will bring their own prescription, but then our medical director also can help with that. So even though we're going deeper, you still really don't feel the pressure inside the chamber, except for clearing your ears. And then maybe if you didn't use the restroom before, you might feel it in your bladder. But other than that, you really don't feel the pressure. But if you are in pain, when you're in the chamber, you have less pain. So I think a good way to think about that is the gentle pressure that's put against the body is kind of like if you hurt yourself, you usually want to cover it up or you want to put pressure on it because it feels better on the pain. And so the pressure inside the chamber feels like that. So it does relieve the pressure more when you're inside the chamber. And then it's accumulative as you do treatments.
And how
Does
long
that
is
help?
that helps perfectly. It's a very cool explanation. I also love it when you said it feels like a gentle hug. I think we don't get enough hugs in today's society.
That's right.
And so it's important to get that embrace and some sort of contact. And I mean, going through it, it's really great to hear that it does require a prescription because you are adding some pressure. I know that a couple of the risks or a couple of the conditions in regards to who wouldn't benefit is anyone who, correct me if I'm wrong, but I think it was something in relation to having some lung issues. We want to make sure that because there's pressure, we want to avoid any sort of lung challenges. Could you tell us a little bit more about that?
Yeah. So really the only absolute contraindication for hyperbarics is a collapsed lung. So your lungs need to work in order for the treatment to work. So in our clinic, we go through a process where there needs to be a medical clearance to get into the chamber. It's very rare that we can't get somebody in. Sometimes it may take an extra, clearance by their physician if they've had previous lung problems. But really the only absolute is collapsed lung. So because it doesn't work.
Yeah. And so from there, let's talk about length of time. I know that you said in some cases people can do it twice a day, but how long are the average sessions?
So an average session is an hour under pressure, sometimes an hour and a half, depending on, what the situation is. And then however long it takes us to get you to pressure and come back from pressure. And that varies depending on the person, because if we have to go slower for one person because of their ears, it may take a little bit longer. But the average session is an hour and a half, I would say.
And one thing I found, like, as you're sharing this with me, and we're looking at pressurized gases and pretty much what it's like being underwater, it takes me back to my scuba diving days when we would go, we'll say 20 to 30 feet. And I remember when you get to that depth, you can't just like swim directly up to the surface, right? There's got to be some sort of ramp up time. Not only because of just like the air pressure itself in your lungs, but like also just the pressurization of the gas. So is there some sort of, I'm assuming, would it be a safe assumption to say that there's like there's a ramp up time to get you, into that actual pressure, and then there's a ramp down time. So it's not like you're just jumping out of the chamber after being pressurized.
Yeah. So it's standard is around a minute per atmosphere. So, or per PSI really. So, like if we're going to 15 feet, it usually takes around 10 to 15 minutes to get you back from pressure.
Okay. Yeah.
We just want to take it slow.
For sure. Safety is
Safety is really important. Yeah.
Yeah. And that's why it's so important to have, say, like a medical director on staff to be able to ensure that, all the safeguards are there. And I'm glad that you have it.
Yes.
And so let's talk about some of the, for someone who's interested in getting involved with hyperbaric, what would be some of the activities they should be doing before? Like how would they get prepared for a session?
Well, I would highly recommend someone be eating a healthy diet. You want to be ingesting a lot of fluids, water, but not before your treatment. So you want to drink a lot after your session, but not before, because then you'd have to get out and go to the restroom. So, but you don't want to be freshly off of an airplane, or you don't want to be flying the next day. You want to leave at least 24 hours in between flights and a hyperbaric dive. You want to come dressed in comfortable clothing. Cotton is preferable, but just anything comfortable. We pressurize with ambient air. So we're not like a hospital setting where we're pressurized with 100% oxygen. So as far as the clothing goes, it's a little bit more relaxed about that as far as the fabric, but just want to be comfortable. We do you have got a pillow in there, a nice mattress and nice little blankie, and you're ready to take a nap. But as far as before, just prepare to not have to go to the restroom and be relaxed and ready to take a nap or read a book.
Right.
And as far as afterwards, if somebody is coming in, there's different reasons you use hyperbaric oxygen therapy. Most of what we do here is work with people that are looking for healing or, from either injury or disease. But we also work with athletes that are coming in for training. So they're working on endurance and building muscle. So if somebody is here for healing, you want to, after you get out of the chamber, you want to go home and relax for the next 2 or 3 hours, because the oxygen is still in your fluids. So the more activity that you do, it's going to use up the oxygen that you have instead of dissipating into the tissue. So if you're training for a sports activity, you'll come in, do a hyperbaric session, and then you'll go work out because you're building that endurance. You're using the oxygen for the endurance and the muscle building. Whereas for healing, we want it to go all into the tissue that is suffering to help reduce the symptoms, to reduce the inflammation, and to reduce the pain. So we want you to kind of relax afterwards so you don't use that oxygen up.
Yeah, that makes sense. And
then prepare to come in as soon as you can afterwards. So if we're doing literally we have people that come in for daily doubles. So that's not unusual if somebody's really wanting to speed up their healing process. And typically we want to have about 3 hours in between. So if somebody comes in for a treatment in the morning, go home, take a nice nap, read a book, watch a movie, something like that, and then come back in again in the afternoon for another session.
That makes sense. Yeah, to be able to just let them acclimate, because to sit still or sit in a confined area for, we'll say 2 to 3 hours can be quite challenging.
Yes.
I know myself, I would get a little antsy and want to move a little bit more. So if we're talking about, say, from a pain standpoint, so the listeners here, they're dealing with mostly sciatica pain, and we're dealing with like more nerve irritation. Oftentimes nerve irritation is a byproduct of inflammation that happens in the body, whether it actually be through an actual physical injury that they're dealing with or some sort of systemic inflammation that they're dealing with as well. When it comes to timing of when to consider implementing a tool like hyperbaric, at what point in the healing journey does that look like? Is hyperbaric more of like an acute injury where it's like, okay, you sprain, or like, okay, I tweaked my back, now I'm having symptoms down my leg. Is this something that I go like tomorrow and do it? Or is it a matter of I had to go through like the other modalities first, physical therapy, like movement, exercise, and then it's like, okay, maybe I can use this to enhance my recovery a little bit further down the road. What's that timeline placement look like?
So after being in this business for 10 years, I would recommend as soon as possible, because the further down that inflammation that we get, the more time it's going to take to work out of it. So typically when someone comes in for treatment for one thing or another, and they learn what hyperbarics does for them, down the road, even years later, they're going to remember that experience. And if they injure themselves, they usually are coming in right away. So acute. Like if they have an accident, they fall and, sprain their ankle or whatever, they want to get in as soon as possible because, literally, if we can get, inflammation is a secondary injury, right? If we can get somebody before the inflammation sets in, that's better because then we can keep the tissue oxygenated and keep the inflammation down. So then we can get a quicker turnaround time for them. So for instance, if somebody has surgery, if they've, we recommend people coming in and doing preconditioning before their surgery. And then we really want them immediately after surgery, literally after they get out of the hospital. We want to get them in as soon as possible to keep that inflammation down, to get ahead of it. So I would say if somebody is dealing with an issue, I would look into it as soon as I could.
And let's talk about what that journey is like. You said that you do need a prescription to actually even qualify or being able to get the treatment. Now, is this something where it varies state by state, or tell us a little bit more about what that process is like? Say, okay, I get hurt. All right, I'm thinking hyperbaric oxygen can actually be a good benefit for me. What are my next steps before actually setting foot into a clinic like yours?
Well, it varies clinic to clinic, how they operate. Speaking for our clinic, one would call and inquire. We usually set them up with a consultation with usually either of us. And then they need to fill out an intake for both the office and for their medical clearance. So before they come in for a consult, usually we have the medical clearance available, or their prescription. So we know whether or not they've been cleared. If there's any kind of a problem with their medical clearance through our clinic, then we will send them off to their doctor to get an okay. So most of the time when someone actually comes in for a consultation, there's sometimes that they just want to come in and check the place out, see what the chambers look like, and get a little bit, more information. But there are other times when people want to come in for a consult and they want to be able to get right in that day. So then the process is we would sit down with them, do the education, go over their intake forms and their prescription and any kind of risk assessment. And then they're able to do what we call a dive the same day. So
Great.
We try and make it as streamlined as possible,
For sure.
But other clinics work differently as well.
Yeah, and I guess my question, part of that question was, what's that conversation like with their doctor? Is it oftentimes that patients go to their doctor and they're saying, "Oh, I'm thinking about hyperbaric," or is this something where the clinician, the doctor, says, "Oh, I think you might be a benefit to that"? What are those conversations like?
Okay, that's a great question, actually. So it can be all over the board. I have to say, unfortunately, most doctors don't know about hyperbarics. They know very little. So there are times when, like I say, we get people coming to us and they have their own prescription from their physician, which is always nice because we loved working with in connection with their doctors. But if it's the other way around, let's say there is a situation where we need them to get clearance by their doctor, maybe because of a lung issue or, blood pressure or something. A lot of times when they go to their doctor and say, I'm wanting to do hyperbarics and need your okay with this, they really don't have the knowledge. And typically they'll give the clearance as long as there's nothing really serious. But a lot of times we're educating their physician about it. Which is
And-
good. I want to do that. It's like we want
Very
to educate more doctors about hyperbarics because we should all be working together for the end goal of helping people be healthier.
Absolutely. I mean, it's another option. It's another really great tool for that. And I'm glad that you said that there are some absolute contraindications and absolute things in regards to in regards to how people wouldn't benefit from that. So I think, again, the reason why we're talking about this is because oftentimes any sort of modality when they're getting marketed or being talked about, they're always being told, they're always conveying that they are the number one solution. And I appreciate it of you being able to say, here are the conditions as to why this could be helpful. So you said that there's many different clinics all throughout the country and also throughout the world. There's one in my neighborhood. Because there's so many, there's probably ones that are operating very well like yours. Some maybe not operating as well just because of the regulations. You have a physician on your team. So for someone who's actually considering hyperbarics and thinking, all right, maybe I want to look into this, what should they be aware of? What are the things that they should be looking for specifically to ensure that they're going to be in a good spot?
Good question. I recommend somebody can always call our office and we can look into clinics in their area. Being in the business, we kind of know what to look for. It is hard to know what to look for. When you say there's a lot of these, there's not a lot. Our industry needs to grow for sure, but there are a lot of offices that just have one portable chamber, the mild chambers. They are not regulated as much as the higher pressure chambers. So, you want to make sure that somebody is certified. And, if I was somebody looking, and if there's just one place in your area, then I would say, go in and take a little tour and see how they operate. And if you feel comfortable, if they feel like there's knowledge, if they're knowledgeable, check to see if there's, inside, look inside, have them show you inside the chambers and make sure that there's like a doorbell in there so that you can ring it if you need help. Ask them what their protocols are. And so if they sound like they sound like they know what they're doing, you want to definitely know that there's safety issues, safety protocols, and that you're going to be able to get a hold of somebody if you need any help in there. You can pretty much tell when you go into a place and talk to somebody whether or not you're going to feel comfortable. But we love to help people to find clinics in their area because we do feel like it's very important, and we feel like there needs to be more of our type of businesses in the world. And so we're always willing to help people to find a clinic in their area. So I wish there was a link there. You could just pop it in and find out. But like when you look up, because there's also, there's clinics that like have just one chamber, but then there's also clinics that are more of like pain institutes where they primarily do like open wounds and burns and stuff like that. And so they only take people that have insurance that have an indication that is covered by insurance. So to speak about that a little bit, there's 16 diagnoses that are FDA approved, and most of what we treat is off-label from the FDA. So we don't take any insurance, and it's rather difficult to get hyperbarics covered by insurance. So there are those clinics out there that are primarily for wound healing, type of services. So they're harder to get into. So like when we look up a clinic online, we can tell whether it's a clinic that's a wound clinic or that's a clinic that they might be able to self-pay.
And I really appreciate you sharing that as well, because even at the beginning of this episode, you said that this is a tool that can help overall wellness and reduce inflammation. and inflammation is kind of found everywhere. And I
Yes.
think that one of the challenges when it comes to trying to find all the various different tools that are out there. I'm glad that you said that this is a supplement. I think that's a huge part. I mean, and then also it leads to the fact that you have a whole bunch of other different services that you also offer as well. But one last question about just like the overall, just trying to find the logistics and everything like that. I think you brought up two pieces. Like one was having a prescription for hyperbarics, and the other one was having medical clearance. Is there a difference between the two?
No, I mean,
No.
they're basically one and the same.
Okay, so usually they would either get the medical clearance from their doctor, and they would come in with the medical clearance and they would give it to you. So you would operate, like, make sure. And is that something that you think, is that something that was like people who should get it, who want to get into hyperbarics, is that something that they should be looking for? Because I mean, I don't know what the industry is like, but is it something along the lines of someone walks in through the street and has nothing and just says, hey, I want to do hyperbarics for the day. And then someone says, okay, cool, no sweat, go ahead and jump on in. Or should it be the actual process of like, we need this actual clearance, we need this prescription to actually go through with the session?
I think that the industry would recommend having a prescription no matter what, but you will find in the industry, if they just have mild hyperbarics, there's a lot of facilities that do not require prescription. For us, we require one either way, whether it's mild hyperbarics or higher pressure.
Really?
You know, one thing that I would like to just say, just when you were just talking about the oxygen. So I want everyone to understand that oxygen is our number one primal nutrient. We can't live without it for even minutes, and we can't heal without it. So it is really, really an important supplement when we're trying to heal, to get oxygen to that tissue. I think we forget about how important oxygen is because we have it all the time. We don't have to go get a drink of water or get something to eat. It's just there for us. Only we're panicked if we can't get it in.
For sure, yeah.
So we kind of forget how important it is.
Yeah, we kind of take it for granted, and I think
we do.
Why it's so important. Like oftentimes when you are dealing with pain, you might even notice that you're holding your breath, and when you're holding your breath, you deprive yourself of oxygen. You develop carbon dioxide, and things can actually become a little bit more challenging. And so it's cool to have tools that are available, like hyperbaric, that can actually help out with healing. So. Yeah, I think you said before you have like a 4,500 square foot healing center. There's a lot of different services. Can you remind us again of what you have? And for the folks who are interested in either hearing more or asking questions, what's the best way to get in touch with you?
Okay. So once again, what we offer here, we have infrared saunas. We have cold plunge. We have vibration therapy, PEMF. We have 2 different types of light beds, and we have lots of different light pads. Light is all about increasing circulation and reducing inflammation, so it works really well in conjunction with hyperbarics. We also have soft wave TRT, and that is a device that is it's a low-level lithotripsy that is used for breaking up fascia or scar tissue or calcification, reducing inflammation and bringing new blood flow in. So it is something that works. It's a very quick treatment that works really, really well for pain. And everything we do works in combination with each other. As far as getting a hold of us, our the best website to go to is inlighthyperbarics.com. We'd also have the Inlight Way. But the Inlight Hyperbarics is probably the best place for someone to go to get more information. Our phone number is 360-326-3264. And we would love to answer any questions that anyone has, no matter where you're at. So another thing that we do, we also, we sell every piece of equipment that we have here. We like to make sure that we can help people to get it into their home if that's what's needed. So we love setting up hyperbaric chambers in people's homes, because if they're really injured or really sick and they can't get out and they need ongoing treatment, we do rentals as well so that people can get their treatment within their home. So that's another thing that we do. And so really we service anyone all over the United States. So no matter where you're at, if you hear this and you want more information, give us a call and we'll see how we can help you, whether we need to guide you to a clinic or, if we can set you up with the chamber in your home or just answer some questions for you. We're here for you.
Fantastic. Listeners, if you did not get a chance to write that down, I'm actually going to put all that information into the show notes. Edna and Caitlin, thank you so much for being the honored guest for this episode. Definitely learned a lot.
Yeah, well, thanks for having us. This is great. And if there's any other of those modalities that you're interested in learning more about, give us a call.
Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.